Like everyone else, here in Davis, California, we watched COVID-19 devastate communities.
Davis is a small college town, so to create the safest environment possible for everyone here in Davis,
We knew we had to draw on all the strengths in our community.
The city and the university teamed up to do what no other place did during the pandemic.
well, the first community spread COVID patient was treated at UC Davis Hospital way back in March of 2020. And it was then that we realized that this could be an issue for not just our campus, but the nation and indeed the world.
So there was really great need for concern back then about the students moving back to Davis and bringing contagion with them from some of the hotspot areas in the country and infecting the townspeople.
That was one of the original missions of Healthy Davis Together. It was a way to partner so that the campus could provide some reassurance to the community that, hey, we really do care and are aware that our students are impactful on the community at large.
It started really with a phone call that I received from Dr. Tom Nesbitt, who's associated with UC Davis. He said, we have an opportunity that will allow us to have a very unique and robust response to COVID and help manage COVID locally. You know, it's not Healthy City Together, Healthy Campus Together, it's Healthy Davis Together. I think it really started with the testing and the testing platform that was developed by UC Davis. And the saliva-based test, which is so easy to administer.
We have the capacity to run a huge number of these tests. We could do as many as 10,000 a day. And so with that high throughput, we said we can not only do regular testing of all the community in the university, but also in the city of Davis and indeed now in Yolo County, our surrounding community in public schools and elsewhere.
I got involved with Healthy Davis Together at the beginning of the project. The leadership team reached out to me. They had heard about some wastewater work that I was starting to do with campus, where we were collecting samples and measuring SARS-CoV-2, and there was the idea to expand this out into the city.
And the same thing too is by having this incredible partnership with County Public Health the way we do, that we can share data, right? And look at case positivity around the whole county.
There was a wide range of interventions that resulted, we think, in lowering the risk of infection. And then, of course, taken to its ultimate level when vaccinations became available, and as they are now, we've seen that a lot of our health education efforts have been focused more and more on kind of overcoming some of the vaccine hesitancy or vaccine uncertainty.
So it's the city and the university, certainly, but also there have been other key collaborators in the process. Certainly the business community, no question. The school district is another example. The county, in terms of the public health officials there as well, too.
Kids are coming back to school en masse, right? So we've got to figure out how to deploy safe environments for those kids in the schools while there's a high density of kids. It's not distance learning anymore. It's not small classrooms, it's full classrooms. So it's really going to put some of our principles to the test, and we're going to have to see how well mass testing works.
In addition to our regular testing of our employees and students, we tested over 9,000 individuals last week, 10,500 in total as they moved into the residence hall space.
We were testing everybody, and including family members that accompanied the students to help move in. We were giving free testing to them as well. I think there's emerging evidence now that we've had a very big impact, that we've had lower case positivity rates in Davis consistently. We saw this divergence of case positivity between Davis, Yolo County, and California, which is very consistent with the intense efforts that we made here in the city of Davis.
The city of Davis is a relatively privileged community socioeconomically, and we thought it was important to not just offer what we were offering to a community of privilege like Davis, but also to reach out into the broader community, which did not have the same sort of advantages. But I think in this circumstance, we've demonstrated to the surrounding community what the benefit of having a major public research university in their region can actually be. And I think there's a great deal more appreciation for the university as a partner in the community.
The university and the city had a low point, probably about a decade ago. And we've been really working to bolster our relationship. But this relationship, this partnership on Healthy Davis Together has just absolutely cemented the relationship between the university and the city.
The magic ingredient to the success of Healthy Davis Together was what I'll call a coalition of the willing. We had a willing community that was willing to step up and really take on the best practices of being safe and healthy.